Hi, everyone, and welcome back to lesson number 2 in module 3 on the reciprocal relationship between society, healthcare, and aging. In this lesson, we will delve into the social determinants of health. In our previous discussions, we delved into the biological and physiological aspects of aging. But longevity and health span are not solely determined by our biology. They're also profoundly influenced by social factors. Welcome to our lesson on the social determinants of health. Firstly, let's understand what we mean by social determinants. These are conditions in which environments where people are born, live, work, and age, they have a substantial influence on our health, well-being, and quality of life. These conditions are shaped by the distribution of money, power, and resources at global, national, and local level. Examples of the social determinants of health include income, social status, employment, and working conditions, as well as access to healthcare and education. Even your zip code can be a predictor of how long and how well you live. Understanding the social determinants of health allows us to see the bigger picture. It helps us recognize that achieving optimal health and longevity is not just an individual responsibility, but a collective one, requiring societal change and multi-sectoral collaboration. In the long run, housing may be more important to health than hospitals. Dr. Lester Breslow, a leading figure in public health and proponent of disease prevention, was born in 1915 and was a U.S. public health titan. Lester Breslow lived to the age of 97 years. His career had a significant impact. He is credited with pioneering chronic disease prevention and health behavior intervention. His work with the Human Population Laboratory in the Alameda County established the connection between mortality and lifestyle issues like exercise, diet, sleep, smoking, alcohol, and so forth. He has been called Mr. Public Health. And he thought that in the long run, housing, like other social determinants of health, may be more important to health than hospitals. You may wonder, why are we discussing something that seems outside the realm of healthcare? Well, here's a surprising fact. The contribution of sectors outside of healthcare, such as education, housing, and employment, actually exceeds the impact that healthcare itself has on population health outcomes. In simple terms, social determinants of health are the conditions where people live, work, and age that impact their health. They serve as a framework for understanding how various non-medical factors contribute to our overall well-being, and why some communities may face more significant health challenges than others. So various studies estimated that social determinants of health may account for anywhere between 30 to 55% of health outcomes. That's a significant portion, and it gives us essential insights into how social conditions can either amplify health inequities or be leveraged to improve public health. So, as we look to improve health span and lifespan, it's crucial to look beyond just biological factors and medical interventions. Addressing social determinants of health should be a strategic way to ensure that people not only live longer, but better as well. So before we move on, I want to speak about the difference between health inequities and health inequalities. You've probably heard the terms health inequalities and health inequities used interchangeably, but they're not the same. health inequities reflect an unfair distribution of health risks and resources that are a result of a systemic, structural, or social issues that give rise to disparities in health outcomes. For instance, if people in low-income neighborhoods have a lower life expectancy because they can't easily access quality health care or fresh foods, that's a health inequity. These are the types of differences in health outcomes that are shaped by the social determinants of health, which we discussed previously. At the same time, health inequalities is the generic term used to designate differences, variations, and disparities in the health achievements of individuals and groups. Health inequality is a descriptive term that need not imply moral judgment. An example of health inequality is higher incidence of Tay Sachs, which is a genetic disease more likely to occur among Ashkenazi Jews compared to other ethnic groups. Let's move back to our previous slides. And we talked about the contribution of sectors outside of health population. Health outcomes exceeds the contribution from the health sector. We also said that between 30 to 55% of health outcomes derive from these social determinants of health. But we also said that the social determinants of health affect health inequities between and within countries. When we mean inequities, we didn't mean inequalities, as we just explained. Inequities are associated with unfair, unjust distribution of resources and policies. By using life expectancy as a measure of health inequities between countries, let's compare Hong Kong, the country with the highest life expectancy in the world, 85.83 years, and Chad, for example, the country with the lowest life expectancy in the world. And we can see that as a result of health inequities, the difference in the life expectancy between Hong Kong and Chad is over 30 years. Here is another example of health inequities within countries. In the state of Kerala, in the south of India, life expectancy is between 76 and 79. At the same time, in the state of Orissa, in the center of India, the life expectancy is between 61 and 64. So we can see that if we measure health inequities through life expectancy, we can see the differences both between and within countries. But what are the social determinants of health in practice? The Global Commission on Social Determinants of Health was established by the WHO back in 2005, with the mission to support countries and global health partners in addressing the social factors that lead to ill health and health inequities. The Global Commission has identified 3 areas for critical action, identified in their report to reflect their importance in tackling inequities in health. The Commission aimed to draw the attention of governments and society to the social determinants of health by creating better social conditions for healthcare, particularly among the most vulnerable people. The recommendations of the commissions were very simple: improve daily living conditions and tackling the inequitable distribution of power, money, and resources. Followed by the WHO, last year, the US Department of Health and Human Services identified social determinants of health as one of the 3 priority areas for Healthy People 2030, along with health equity and health literacy. Social determinants of health, according to Healthy People 2030, can be grouped into 5 domains: economic stability, education access and quality, healthcare access and quality, social and community context, and neighborhood and built environment. Let's delve into economic stability. The goal of Healthy People 2030 is to help people earn steady incomes that allow them to meet their health needs. And if you remember, as we talked previously, income is one of the major social determinants of health because it is strongly correlated with health outcomes. And according to Healthy People 2030, if people, mainly from underserved communities, will earn steady incomes that allow them to meet their health needs, then it will improve also their health outcomes. See you in our next lesson.